We're going to spend a little bit of time learning about a system that by all accounts you've spent very little time so far in any of your other classes, one that they want you to cover in grade 12 healthcare. We're going to spend a little time on the lymphatic system. It's not a difficult system to understand, but the fact that you've had very little understanding of it in terms of any other exposure from other classes makes it, I believe, to be a little bit tough at first. So to make it easier, what I have is a audio or video converted PowerPoint with me speaking about some highlights of the system. I found a very useful YouTube video that's about 4 minutes, 4.5 minutes long, that again highlights a little bit of the interesting and common and very characteristic features of the lymphatic system. I'm going to upload a couple of animations, brief, short animations that show a little bit about how the lymphatic system works. And then I'm going to finish it off with a little assignment, a very brief assignment that I want you to complete, that I want you to hand in to me, and I will give the date, the due date at a later date. In order to understand a little bit about how the lymphatic system works, you need to remember a little bit about diffusion and osmosis. And those are terms that, although you've learned them and you've heard them and you've read them and you've memorized them, sometimes students don't really understand the full magnitude of what they actually mean. I'll give you an example of diffusion, that how I explain it in my classes. Imagine I'm at my desk and I spray 10 seconds worth of Axe, and the first person who's sitting in the desk closest to me is going to smell that Axe very, very quickly. Yet the person way over by the door isn't going to smell it yet. So what happens is there's a high concentration of Axe molecules in close proximity to where I sprayed, and there aren't any towards the door. So over time, those Axe molecules are going to move from an area of high concentration where I sprayed throughout the room until they disperse evenly to other areas of lower concentration. Diffusion is referring a lot of time to the movement of molecules. Osmosis, on the other hand, is the movement of water from an area of low solute concentration to high solute concentration through a semi-permeable membrane. And what I want you to get from the pictures on the right, A and B, those molecules in the water are too big to move through that solution. Yet they yearn for an equilibrium or a balance. So the only way that you can have that happen, since the molecules can't move to balance off and have equal number of molecules on each side of the membrane, the only way that you can make the concentrations the same is to move the water from an area of low solute concentration on the left over to an area of high solute concentration on the right. So it's the movement of water. And I'm just going to refer to this diffusion and osmosis as I explain a little bit about what happens and what is the reason why we need the lymphatic system. Okay, there is a lot going on in this slide, and I could make it very difficult, but I'm going to try to make it very, very easy so that you can get the gist of how the lymphatic system plays into this. You can see that this is a picture of a capillary, and we know that that is the blood vessel by which exchange or gas exchange takes place so that you can move the good nutrients and oxygen from inside the blood out to the tissues. And we know that the cells undergo cellular respiration. Oxygen plus glucose gives you CO2, water, and energy. So we have to get the good stuff from the capillary out to the cells. The only way that you can move that is in solution through water, through the movement of water. So glucose and oxygen has to move from an area of high concentration in the capillary at the arterial end out to the cells. And it's the blood pressure that helps is the driving pressure that helps move that, or helps aid with the movement of these items in solution with water from the capillary to the cell. We refer to that as filtration. And as we said, when you start losing fluid volume, your blood pressure is going to go down. So as you look and move from the arterial end of the capillary to the venous end of the capillary, you'll see that the blood pressure gets less and less. One thing that you'll notice is that there's another pressure on the venous end of the capillary that helps reabsorb the water back in. And you need to reabsorb the water back in, because if you didn't, you'd end up with all this fluid out in the interstitial space, and you'd have swelling and a lot of edema, and you can't have that. You have to have the water be reabsorbed. Through cellular respiration, you have a lot of CO2 in the cells and less CO2 in the capillary. So it wants to move from an area of high concentration to low concentration. And again, it's going to move in solution in the water along a concentration gradient. There's a pressure that helps drive that fluid back in, and it's called the osmotic pressure. Inside the capillary was a plasma protein that you learned about called albumin. And I said to you earlier that that is used for fluid reabsorption. The albumin is too big to fit through the pores in the capillary walls. So you want to establish an equilibrium. So the only way that you can do that is to try to bring the water back in to reduce the concentration of albumin inside the blood, inside the plasma. So that is the driving force that helps the water get back in. Now, the only problem is that only about 85 to 90% of the water can be reabsorbed through these pressures. You're left with about 10 to 15% of the water that just can't get back in and can't be reabsorbed, and that's problematic. You have to have all the water be reabsorbed and accounted for, and that's where the lymphatic system comes into play. The lymphatic system is a group of vessels, another transport system, if you will, that is responsible for, among other things, reabsorbing the remaining 10 to 15% that can't get back into the capillary. That's kind of the short, quick version of it. As I say, I could get much more into it than that, but I'm going to kind of keep it simply at that for the time being. Feel free to look at a couple of the animations to help explain what we call capillary fluid exchange and see if it helps, because this is a topic that you are all going to cover in great detail if you get into any medical career, because a lot of health complaints and medicines work with an understanding of capillary fluid exchange. This shows a little bit of the diagrams of the lymphatic system, and on the left, you can see it more at a sort of a microscopic level. Red is often referred to as sort of oxygenated capillaries and arteries and so on, and blue is often thought of deoxygenated and venules and veins and so on. Well, green is the color that is often used to depict the lymphatic system. So the red is showing the sort of arterial end of the capillary, the blue is showing the network of the venous end of the capillary, and then the intertwined lymphatic system that is designed to reabsorb the remaining 10% of the water that doesn't have the ability to be reabsorbed back into the capillary through the pressures that I spoke about earlier. On the right, you're seeing that shows the network of vessels, how they're sort of spread out through the body. This is kind of a generalized schematic, and many of us have collections of blood vessels along a very similar pattern to what you see here. And you'll see that the lymphatic vessels start off very small, and they get larger and larger and larger until they eventually drain into very large vessels that return the fluid back into the general circulation. The sort of little nodules that you see in the diagram as well are all the lymph nodes that are, again, intermixed amongst all these vessels that we'll talk about a little bit more in a minute. You'll notice that in the center of the diagram, there's something called the thoracic duct. The thoracic duct is the largest lymphatic vessel. It is in the lymphatic system what the vena cava is to the venous system, or what the aorta is to the arterial system. They're the largest vessel. So the thoracic duct is the largest duct, and you can see if you follow it up at the top right of the diagram, you'll see that it eventually drains into the subclavian vein. Now it gets back into the general circulation and the water has been reabsorbed. You'll notice at the bottom, on the right picture at the bottom, you'll see a blue and green diagram. You'll see that the blue makes up about 3/4 of the body. The thoracic duct and all the vessels that drain into it are responsible for all of the lower extremity and the anatomical left side of the body. You'll see the green side, you'll see that there's another smaller duct called the right lymphatic duct, and that's what's responsible for draining the right arm and chest and the right face. And similarly, it drains into the right subclavian vein to return that fluid back into the general circulation. You'll see that there's some other organs as well, spleen, the thymus gland, tonsils, and so on, the red bone marrow, Peyer's patch, and lymph nodes, and we'll talk about those a little bit more in the upcoming slides. This is a collection of the terms of the anatomy of the lymphatic system that I want you to be aware of. Lymph is the name of the fluid that is found inside the lymphatic vessels. So we call it sort of plasma in the circulatory system, while the fluid is called lymph in the lymphatic system. Again, the lymphatic vessels, I want you to look up a little bit about them, but you're going to see that lymphatic vessels are very similar to veins in terms of their structure and their design with valves and so on, and the way that they require sort of external muscle contraction to help move the fluid back in the direction, in a one direction manner. I talked about the right lymphatic duct and the thoracic duct being the two large ducts that all the lymphatic vessels eventually drain into, which connect into the veins to get back into the general circulation. Lymph nodes are little nodules of lymphoid material that are loaded with white blood cells and lymphocytes that almost bring a connection of the immune system into the lymphatic system as well. The lymph nodes are kind of like little filters. You know, when you're making spaghetti and you drain the water out of the noodles, the water drains through, but the noodles remain trapped inside the strainer. That's kind of what the lymph nodes do. They allow this lymph that is rich, unfortunately, with bacteria and other microorganisms that are inundated in the lymph to be filtered out so that they can be neutralized and dealt with. So the lymph nodes are located strategically in the body in areas of great importance, like around the groin, around the breast, and the neck to protect very vital areas of the body. Lymphocytes are the predominant white blood cell that are part of the lymphatic system. The palatine tonsils and the pharyngeal tonsils, otherwise referred to the tonsils and adenoids. This is an array of lymphoid material that is found in your throat. Your mouth is a very dirty area, so these are your number one primary defense to prevent anything foreign from getting deeper into the body. So your tonsils are located in, as I say, the throat area that help protect, and they're loaded with lymphocytes as well. Spleen, you're going to see that it holds a very important role with helping get rid of old worn-out blood cells. The thymus gland, you're going to see that it's an important area that's responsible for manufacturing T lymphocytes. And then the bone marrow, also all blood cells are manufactured in the bone marrow, and not surprisingly, a very important lymphocyte called B lymphocytes are made in the bone marrow. So that's a little overview. I want you to look up a little bit more of that on your own, but that should certainly get you started. You probably remember me saying, those of you that had me for grade 11, that man is not an island. And that was an acronym I was saying to you to imply that no, you're not meant to be alone. And a lot of these systems of the body are not meant to work independently. They work collaboratively together, and the lymphatic, immune, and circulatory systems certainly do. I said the lymphatic system is responsible for that system that helps you reabsorb water, but it's also inundated with lymph nodes and a number of several key immune cells that help protect the body from any foreign invaders that might be circulating. And then eventually the fluid gets to the subclavian veins and back into the general circulation, which is part of the circulatory system. So these systems all kind of work together strategically to work in a manner of fluid retention, immune and foreign control, and moving vital fluids around the body to all key areas of the body. The picture on the left, lymphedema, is very, very common for individuals that have had, for ladies that have had mastectomies, radiation, and and surgical treatment to remove a breast. When they do that, you can sometimes damage the lymphatic vessels and make it difficult for that fluid to be reabsorbed back into the general circulation. So you can certainly see that the left arm is very edematous, and it's because it's very difficult for that fluid to be reabsorbed back into the body. And you might ask yourself, well, how is this treated? Well, you might have heard of something called a diuretic. That's a water pill. That's a pill that can help the body sort of reabsorb fluid and minimize the amount of fluid that exudes out into the tissues. You could put a very tight stocking sleeve around the arm to create a bit of pressure that helps the body reabsorb the fluid as best that it can. You could also do like what we call a lymphatic massage, where you would start at the hand and fingers and kind of massage with a deep pressure to try to help the fluid be reabsorbed back into the system as well. So there's some strategies that you can do to help with lymphedema. This is very common, not always entirely, but very common, as I say, with mastectomies. The pictures on the right, you've probably had your doctor feeling, they say to you, I'm feeling your glands. Well, what they're actually feeling is your lymph nodes. And if you're having any kind of active infection, your lymph nodes are going to have trapped more foreign invaders, and they're going to be enlarged, possibly a bit tender, and in the case of the diagram on the right, even noticeable. This is what we call lymphadenopathy. These are enlarged lymph nodes that in some cases are even visual, and so you can feel them and you can see them. And again, they can be an active sign, a sign of an active infection. And in some cases, to be quite honest, they can be common without really any concern. I can speak that my son had a large one in the occiput, which is sort of just behind his skull, behind posterior to his ear. And I had it looked at by an oncologist and a specialist, a cancer specialist, and he confirmed that it was of no significance. And he, to this day, has it noticeable. So not always a cause for concern. This is a condition called ascites. This is not a beer belly. This is a condition where an individual has some difficulty reabsorbing the fluid back into the general circulation. So it gets trapped out in the interstitial space, the space that is bathing all the cells. And this is usually as a result of liver failure, because the liver is the organ that's responsible for making albumin. So if you're not making sufficient albumin, you're not going to have enough albumin circulating in the plasma, acting as the agent by which the osmotic pressure helps reabsorb the water back into the capillary. So in this case, this is the concern that you're having because you're not able to have an effective manner by which the fluid can be reabsorbed. My cousin had this. My cousin was not a drinker. He had hepatitis and ended up having to have a liver transplant. And prior to his liver transplant, he had a very large abdomen like this. And they actually had to use a needle, and they were draining literally liters upon liters of fluid from him every day. So it can be a very serious health concern as a result of your body not producing or having effective use of its albumin. This is showing again a diagram of the pharyngeal and palatine tonsils. The pharyngeal tonsils are also known as the adenoids. So these are lymphoid tissue that is found in the back of the throat and deep in the throat, base adjacent to the nasopharynx. And again, your mouth is dirty, so this is a primary sort of safeguard that allows anything foreign to be addressed through an array of white blood cells that would be found within this lymphoid material. The problem is that some people, like the picture on the right, can have very enlarged, inflamed, and exaggerated lymphoid material, and this can make it very difficult to swallow. So you may have heard, or maybe you've had yourself, someone that has had their tonsils and adenoids removed, and that was at one time done with great regularity, but nowadays it's not done nearly as often. We try to keep these lymphoid materials there if possible, and certainly address any kind of recurring infections through other methods, maybe medications or so on. But they still do have to be removed on occasion when they get inflamed, enlarged, and make it difficult to swallow. You may have heard of something called Hodgkin's and non-Hodgkin's lymphoma. And these Reed-Sternberg cells are a large abnormal lymphocyte that is found in those people that have Hodgkin's lymphoma. So if you're trying to determine the difference, you suspect that someone has lymphoma, but that you're not sure whether it's Hodgkin's or non-Hodgkin's, you'll study the blood for the presence of this particular cell that can help you be a little more accurate in determining the type of lymphoma that might be present.